Okay, so this is the foil wrapped 12 drug barrel test. Again, you've got all the CE markings and label identification on here. Removing it from the pouch, you get one of these barrel tests. What I've already done is remove the central section, which is covering the results window. Now you can leave that in place until the test 5-minute run is complete if you don't want the person that you are testing to see the results forming, or you can remove it before you start adding the saliva. It makes no difference at all to the running of the test, just a procedural option for you. The stalk with the sponge on is too long initially to go down. That's because the sponge is completely rigid when no saliva has been added. It's the compression of this down into the tube that releases the saliva into the bottom chamber here, and you can see the peripheral 12 test membranes which have to be saturated in that saliva in the bottom of the chamber. So it's important when you squeeze this test out for it to be in the upright position. Now the swab you'll see here comes out of its cellophane wrapping. It's firm and rigid initially. This bit has to be completely saturated in saliva and oral fluid. It will go very soft and squishy at that stage and allow you to compress the test. The initial procedure for collecting samples would be to move this around the top buccal membrane and bottom buccal membrane in front of the teeth down each side of the cheeks. This can be done by the person that you're testing. Just ask them to rub it gently on the side of their mouth, each side, top and bottom, and then pass it on towards the top of the tongue and just ask them to hold it in their mouth and feed saliva gently onto that swab until it's completely squashed and is soft when they move it against their tongue. You have to get a good volume saliva sample in that sponge to run all 12 of these tests. Too small a volume of saliva, or somebody that's not giving you an adequate saliva sample, you're going to get 1 or 2 of these test membranes running, or in some instances none at all. So a key element of your saliva sample collection is to make sure that that swab gets completely saturated in saliva. If they really are not going to play ball with you, the other alternative is to ask them to produce a saliva sample into a clean cup and then saturate the saliva swab into that cup. You will not get as good a sample with that. You should, if that's going to be the case, still rub the dry swab on the inside of the top and bottom of the mouth to pick up drug residues before adding it into the collected saliva sample. So now what we're going to do is saturate that into saliva and show you the test being run.